Healthcare systems and services, what are they? And once we have some information, what do we do about it? To help us better understand these concepts, let's look at a scenario. Susan is physically, mentally, and socially healthy at 9 years old in 4th grade. Earlier today, Susan was riding her skateboard home from school and hit a pothole on the street. She ended up falling from her skateboard and breaking her arm. What should she do? Now, unless mom has medical training, Susan needs to be rushed to a medical professional, and depending on where she lives in the world, she'll have a specific health system and service that will take care of her. Before we continue with Susan, let's talk about some physical examples of health services. These can vary widely from an established hospital or clinic to a mobile healthcare vehicle, tent, or even duffel bag medicine. These are all considered services because they fulfill a health need for an intended population. We have these health services all over the world. The question, though, is how do we access it? How do we get Susan some help?
Depending on the care that's needed and where you live, you'll have different actions to take. If Susan had suffered a minor injury that didn't require any professional attention, then you could run to a local pharmacy, clinic, or even just a convenience store and grab what she needs. But since she's broken her arm, you will likely have to jump through a few hoops depending on the country. Many countries adopt different systems to administer that health service. One is private healthcare or private medicine. This is healthcare and medicine provided by entities other than the government, so it's given depending on if you can afford it or if an insurance policy can cover it. Another is universal healthcare. This is a system that provides quality medical services to all citizens. The federal government offers it to everyone regardless of their ability to pay, and it's often funded through taxes. The last option is that there is no official healthcare system set by a government, and you're kind of just left seeking out care from whatever is available.
Okay, back to Susan. Let's see what would happen to her if she were to break her arm at different places in the world. Let's first look at France, a country that is believed to have one of the best healthcare systems in the world. They have universal healthcare. Susan would be provided healthcare independent of her finances, and because of the abundance of services available, she could be seen rather quickly. Not all countries have as many services available though, like Canada, who is ranked 30th in the world. So, it can be a drawback if they don't have as many services because everyone is able to be seen, but sometimes there can be quite a waiting line.
Next, let's look at the USA, which is mostly private and is ranked 37th in the world. The hard part for a private healthcare system is being able to reach minority groups that can't afford the large price tag that comes with the service. Lastly, at 175th, South Africa is 20% private for the extremely wealthy, with the remaining being public or just wherever you can find a health service.
So what's the ideal healthcare service and system? The answer is that it depends. There are benefits and drawbacks to all systems. The pressing point is to make sure that Susan gets her broken arm fixed. So a combination of the three would be preferable. One that's readily available, affordable, and accessible.